I've gotten all the blood tests to see if there was anything that showed up that could explain a concern with like your energy levels or your thought process or anything like that. And it actually all looks pretty good. Your potassium's a little bit high, and so I've gone back through your chart, and it looks like when you were here last time, they'd asked you to stop taking potassium.
They gave me potassium IV.
In the
Then they
hospital.
gave me in the hospital. They gave me potassium pills, several pills, and
Which
so
you
I
probably
figured.
needed it then.
Then I go over there to the care home, and they're giving me potassium pills. Then all of a sudden they come and say, "Oh, your potassium's too high," because they're giving me all these
Yeah.
potassium pills.
Well, I mean, that could have been a miscommunication, but I do think you should stop the potassium pills at the care home. And we can call that. We can.
Every time I ask them, "What kind of pills are you giving me?"
Yeah.
They say, "Well, you don't have to worry about it."
Well, I'll call them and I'll tell them to stop that, so that they don't keep giving you those.
So that's why I'm here, because they're giving me too much potassium.
No. To be honest, like we've been trying to figure out why you're here. So I went back and I read all the notes. I read the dialysis notes, and it sounds like at dialysis they were worried about your back pain that you had during dialysis, so
Yeah.
they sent you here yesterday.
When I was in the hospital, and they told me they're gonna do the quadruple bypass. Then they said they can't do it because of my legs can't go. So they're gonna give me the what is that one? The one that stents. So they do the stents, and then I'm telling them when I'm coming out of the operating room, I feel pain over here. And then they say, okay, well, we don't know what. And then the next day I tell them I got pain over here. And then the next day I'm getting pain is crawling up my back over here, two over here. And then they said, well, we don't know why, because, and my breathing was supposed to be better after that. So I said, well, I'm coming out of the breathing just like when I went in a hospital, breathing and high. And every time they take my this one, it's
Your oxygen
always
level,
99, 100%. And I'm breathing really hard. And every time I come out, I stand up to walk, and I'm breathing hard. It's breathing 100%. And when I'm laying down, it's 100%. So how can my breathing be the same, 100%, and my relaxed breathing is 100%? I go over there to the care home. It's 100%, 100%. And I'm relaxed breathing at 100%. I come over here, it's 70-something%. I don't understand.
When you were here earlier, it was kind of going up and down, and sometimes if we like start to fall asleep or something like that, we slow our breathing a little bit, and it can drop. I wonder though, sometimes when you're breathing hard versus when you're breathing relaxed, if you're trying to get rid of carbon dioxide. So we breathe for two reasons. One is to get oxygen in, and the other is to get the carbon dioxide out. And so when we breathe hard during exercise, it's not always to get more oxygen. Sometimes it's to get rid of the kind of the toxic gas in our lungs, because that can help
And
us
it'll
do it.
still read 100%.
And it can still read 100%, but we're just trying to get rid of the bad gases out of our body and bring the good ones in. So, but you were here yesterday with Doctor. They did a CAT scan. They didn't see any bleeding or any problems here.
They didn't see any problem with my pain over here. The pain that I left the hospital with,
Yeah.
it was no problem.
And so yesterday you went back to the rehab center.
And I went back to the rehab center. No, when I was there at the dialysis, and I was breathing, it was hurting. When I
This
left
was yesterday, right?
This was yesterday.
Yeah.
When I left that place over there at the care center, I was breathing hard too. And so, but it's so early in the morning, and I'm telling them it's hurting me when I'm breathing like that. And so, even before, when I went on the other dialysis days too, it was hurting me. And when I do the, what do you call that, the rehab,
The cardiac rehab, when they're
Yeah.
having you do the exercises.
where they're doing the exercises, it's hurting me, and I tell them it's hurting me, so they give me the what is that? The the ice pads.
Mm-hmm.
Okay, so they give me the ice pads, and when I do the other exercises, they give me the hot heated pads so that I can, because I'm saying I'm hurting. And then so the hot heated and then the cold beds, and I'm still hurting here. So when I went to the yesterday, they said it's still hurting, so they wanted to find out what else.
Mm-hmm.
They even gave me a couple of nights ago, what is that? Um, what is that? I know what it is. It's not coming out. They gave me some the testing. The what is that called?
Which one?
Huh? He came in and he gave me I was laying on the pad thing, and he was giving me testing on what was going on with my sore, my hip. That's the kind. I know what it is, but can't think of that right now. When they gave me
It's okay. It was the treatment that they were doing at the.
well, they were doing the testing on my giving me he was giving me the testing on my over here, and he tested it, and I never got the what happened after that
Mm-hmm.
from the doctors there. So after when you go to the ER and they did do the testing, all kinds of testing on you.
Mm-hmm.
William, you were there. You went out of the room. What is that called?
Here?
No, over there, when the guy came in, he did all the shots, all the different shots of my over here.
Oh, the X-rays.
X-rays. Thank you. I just couldn't. You say it to me. X-rays.
X-rays.
He came and he did all the shots of the X-rays, and I haven't heard anything about it either.
Well, you had a CAT scan done yesterday as well.
I had a cat. I had him in the hospital. I had him in
Yeah.
there.
And-
I had the.
And specifically yesterday, they were looking for bleeding back here. They were
Yeah,
looking for other problems,
that's
and
what
it
they
looked very normal.
See?
And so, as far as an explanation for why you've been having pain there, they were thinking of could this be a pinched nerve or a pulled muscle or something like that. But from the perspective of the emergency department, we really, really care about making sure it's not something dangerous or something that would require surgery or would require you to have to stay in the hospital. And so, from that perspective, that CAT scan looked good, and that's why they let you go back to your rehab
Yeah.
facility yesterday.
Yeah, yesterday.
And so my question is, why did they send you here again today? Because you came here today from the rehab facility, correct?
I was no. Oh yeah, from the rehab facility. They sent me there because I was getting ready to go to church, and when I was with my roommate, and she was going to go to church too, all of a sudden I just went and laid down on the bed, and I felt like I was dizzy, and that's how I was feeling all the other times too. And then this was hurting, so I went back down over there, and I slept, laid on the bed, and then all of a sudden they were coming to me and saying. Then all of a sudden I saw these guys, and they were taking me in an ambulance, and I was like, "What's going on?" And they said I was reacting. I wasn't reacting to some of the things that. And I said, "What are you talking about?" And all I could hear when I woke up that morning was water, like water sloshing, and I couldn't hear what the people were saying because all I could hear was water. And I said, I don't know what you're saying.
Yeah.
And all I hear is this water sloshing around.
Yeah.
And I said, you guys hear it? And nobody could hear the sloshing, only me.
Yeah. Well, tell me.
And I came over here, and the same thing too. I couldn't hear what they were saying. I said, do you guys hear the water? And then one girl said something about, oh no, it's this thing.
Oxygen.
Yeah, the oxygen.
Are you on the oxygen at your rehab center right now?
No, they try to put me on because at home, sometimes I would be on oxygen. But they told me to go when I came home from the COVID, when I had COVID in February, whenever that was. And so when I did that, they said I should use the oxygen, but if I needed it, and when I go home, I would use it, and I would use it not to the number 2, I would use it to 1.5,
Sure.
because it was too strong. I would bleed.
Yeah, it dries your
So
nose out.
I would do that, and then I wouldn't hear all these sloshing things.
Yeah.
What I do hear is when the pain is over here, I hear and I feel, can you guys feel the buzzing over here? And nobody feels the buzzing. I only feel the buzzing inside me,
Yeah.
and it's like, it's just buzzing. And I
Yeah.
can feel that going on right here in this area.
Yeah. I wonder if that's
Nobody
nerve,
else.
I wonder if that's nerve pain. Because sometimes when you get a pinched nerve or a nerve that is irritated, you get a little bit of like a tingling or a
It's like
perhaps a buzzing sensation. We call it maybe a paresthesia, where it's
nobody
like a
else
tingling,
feels it, just
shooting,
me.
buzzing type of pain. And,
Yeah,
and I do wonder if that's what's going on. I have a question. You guys are a family, right? How is she thinking and acting and talking right now compared to her normal?
She's doing very well right now.
I think so too.
Yeah.
She's sharp. She's remembering everything in her history other than the word x-rays.
Yeah.
Not the word, but
Yeah. Because when you first got here a few hours ago, you were much more sleepy than you are right now. And I was able to have a conversation with you, and you were able to tell me you were here yesterday, you saw a doctor, you had these things done, but it wasn't quite as with as much energy as you're speaking right now. And so I'd like to just do a quick test, recheck your potassium level, see where that's at right now.
so what does the potassium do?
Potassium is really, really important for all of our muscle contractions, our nerve impulses, just the way our bodies function. So you need the right balance of potassium and other electrolytes too for all of our organs and organ systems to even work.
So if they're giving me too much potassium, and then all of a sudden it's oh you're getting too much. What is that? What did I do to get the potassium to not work or to work?
It's a good question. So in your case, you've been doing peritoneal dialysis for years,
9 years.
and you've got a system that works for you. And normally our kidneys help maintain the potassium balance properly and our diet, and it all works together. For you, you've been doing dialysis for that. And then you had a big change with the,
Yeah, I
With
had to go
the-
do the other one because the care home doesn't allow
right.
peritoneum.
And so that's a change. And then you've also had some changes in your medications as you've gone through all of this with your heart and everything else. And so I think everything just might be a little bit off right now. And that may lead to you not feeling great at certain times of the day, depending on when you get your medications and all of that.
When I asked them, what is this for? Because it doesn't look like the pills that my regular doctors give me. They said they can only give me that because the hospital doctor said this is all I can have. So my what do you call, my insulin that they give me is totally different from the other insulin. When my doctor told me to stop this other pill insulin, Januvia, a long time ago, he told me, but now I'm getting that back with this doctors here.
Yeah.
And so it's things that they told me when the kidney people give me and tell me to take this after every time I eat a meal, and then say no, I cannot take this because the doctor over here at the hospital said no, you're taking this pill, so it's all off.
Yeah.
And so I'm thinking though,
Yeah.
they're giving me these pills that I don't know what they're giving me
Yeah.
for. I asked them, they tell me, what was the word the guy tell me? Oh, don't worry about it.
Yeah. So there are more than one way to get to the same result. So as far as managing your blood sugar and making sure that it's in a safe and healthy range, you can do it in a bunch of different ways, with a pill, with insulin that you inject, with other medications, by changing your diet. And as long as they're getting you to the right spot while you're doing the rehab, I think that's probably okay.
Well, I called the other doctors. I called the diabetes doctor, and I spoke with the nurse there, and she said that it's against the law for them to give them anything else if the people from the hospital said this.
Right.
And
so
then
so
I
th-
called
so,
the kidney doctor. They tell me the same. It's against the law for them to prescribe anything because they got to go through.
Right. So they're bound by what they have to do, and
Yeah.
what they have to do is give you the medications that you were discharged on from the
Yeah.
hospital. So I want to call them right now, and just go through the list and make sure that everything is appropriate and the way it's supposed to be. And if that looks good, and if your potassium level is a little bit better than what it was before, and you feel great, and you guys think that she's sharp as a tack, then I think she can go back.
It's not sharp exact now. I can't even remember it.
Hey, we all have lapses where we forget certain words. That's okay.
I went to the care home.
I forget everybody's name all the time out
I do too.
Well, when I was at the care home, I didn't know she was here. So they updated me of what was happening. She said that she wasn't responding. She wasn't being able to hear properly or whatever. Like, okay, so.
I
Yeah,
was
and-
responding
and-
because I didn't hear him.
Well,
I was.
there's all kinds of things that can explain that too. If your blood pressure was a little bit too low for a period of time, or if your medications were too strong, and all that, and we have good tests, but I can't know exactly what happened at the care center, because here her blood pressures look great, her oxygen looks great, her heart rate looks great. So let me just go verify the medications and we'll see. How much longer do you have at the rehab facility before you get to go home?
Well, first when they told me from the hospital, they told me it was going to be about a month.
Mm-hmm.
And then when I get over there, it was after 2 weeks or something. The doctor says, "Oh, you look like you're going to go back in a week." After a week, but I was wondering, so how come I'm over there and this is hurting so bad? Nobody addressed that. And so when they told me at the hospital, when I kept telling them, I asked the nurse, "What is this over here?" And she told me, "That's your
Kidneys.
kidney."
Yeah. No,
That's your kidney.
Yeah, it shouldn't be
And
hurting
so
like
I
that.
go over there and I said, "Okay, so I need to speak with somebody who would help me, who is doing the peritoneal dialysis for me in the hospital." So they said, okay, he had already seen me the night before and it wasn't hurting like that. And so, and when I asked her what that was, she said the kidneys. And so I said, so I need to talk to somebody about that because it's hurting me.
Mm-hmm.
And so she said, okay. The next day he's supposed to come in, but they sent me over to that place already, so he never came
So you
in
never
time.
had the follow-up, right?
So I asked them about that over there, and then they said, "Oh, you will get a doctor and have you talk to them." Well, the doctor that came in and said, "Looks like you're gonna be going home in next week, early next week." I said, "Okay, but tell me what I gotta do about this. Why is it hurting?"
Mm-hmm.
And then this other lady came in, and she said she was a doctor, and she said, "Oh, we're gonna send to do the testing on that," which was the one.
The CAT scan yesterday.
Okay.
Yeah.
Okay. And then they never sent anybody, and the doctor came in and said that, "Oh, looks like it's gonna go good. You're gonna go home." And so I said, "So what about this again?" And then he said, "Oh, I already talked with that other doctor." Well, she came in one day and she saw me hyperventilating or breathing so hard, and I was just like this on the bed, and I was doing that. And so she called me Nellie, and when I heard her voice, I was thinking, now whose voice is this? And then I saw her face, and I didn't know who she was. She goes, "It's me, Dr. Mary Beth, whatever her name is." I go, "Oh yeah, I remember you." She goes, "Are you okay?" And I said, "I'm just having a hard time breathing." And she said, "Well, I'll go order the test to get the X-ray done."
Mm-hmm.
And then they ordered the test, and they never told me what was happening.
Yeah.
And then they sent me to dialysis, who sent me over here.
Right.
Who sent me back, who sent me back.
And to be honest, the CAT scan is better than the X-rays, and so if was anything there structurally, bleeding, infection, we would have seen that on the CAT scan. It's not very good at seeing a pinched nerve or some of those other types of problems that can lead to a lot of pain too. So we do have, I can put an order into the computer to have our social worker call you from the specialty back pain clinic. And they can call you and set up physical therapy. If you need to have a different imaging test done or a steroid injection into your spine or whatever, they can help coordinate that too to make
Isn't
sure.
that what they did? those people at the care home?
See, the problem is I can't see all the records from the care home. I don't know. I don't know what
I
they
told
did.
them that they had, you know, a hospital before I came there. The hospital took lots of MRIs and CAT scan and stuff like that.
Yeah,
And they said, well, we'll do the one I'm talking
the
about.
X-rays.
Yeah.
Yeah.
Okay, so if you do that one, then what happens when the doctor there is saying he's going to discharge me? You know, looks good. You're going to discharge me, and he comes in when I'm laying down and feeling, you know, great, and then that's all they see. So I don't know. And then I said, okay, so what's going to happen with this? Because
Yeah.
why would I want to go home? I want to go home so bad, but why would I want to go home? And this is hurting, and I don't know what to do about it.
Yeah, that's why I think if we have the follow-up in place for you for that, regardless of if you're at the rehab center or not,
And then they
somebody that she can go see to,
and
to
then-
continue to try and get answers and treatment for this.
and that's why that kidney person, that Phyllis Asseltine, the one who
Uh-huh.
came in the dialysis center to check people out.
See, you remember names better than I do.
Well, she comes in for my peritoneal
Yeah.
and checks me, and
okay.
every time
So
I
you've
have
known
a
her for a while.
clinic,
Yeah.
she's the one who comes in.
Yeah.
So that's what I was wondering. I want to go home, but I want to make sure that when I go home, I don't have to go back later on because they still didn't address this.
Yeah. Well, I don't.
And then I get now the heart the heart people who do the what those guys going to do in the home. And now I was assigned to go through there from Dr. Min somebody, and so they started my doing rehab. That's the word. With me this last one, and so they now told me to come to the heart place over here on the fourth where the heart doctors were, where I went to get this done. So I'm doing rehab, and they started me up doing it last week, and then now they told me to come on Monday and Fridays to
Okay.
do it
Okay.
to that heart rehab center.
Yeah. So I feel like we have a few things we've got to address. One, just make sure your medications are correct. You know, and then two, make sure you have proper follow-up to continue investigating the pain that you're having and to get treatment for it. Because I feel like so far we've just been able to say it's not this, it's not that, it's not
Yeah.
whatever, but we've not been able to get you an answer or help you get feeling better. And then we also just need to make sure that your numbers look good here so that you can go home tonight. Okay? Because
Oh,
I think you've been here long enough. You tired of being here with us, or
that's why I was asking some of the girls, what am I doing here? I mean,
Yeah.
nobody's told me anything.
yeah,
And I think I was getting very rude, but I'm sorry.
you're just fine.
One of
That's
the
fine.
nurses told her, you don't have to yell.
Yeah, no, but earlier you were just a little bit too sleepy, and so we were kind of waiting till you woke up a little bit more, and we actually tried calling your husband as well.
You know what? My phone rang, and then I saw later on when I was awake, oh, they left message on my phone.
For him.
Yeah.
Yeah,
So
yeah.
I didn't know.
And so we
until-
also called the care center too to try and figure out the timeline with the dialysis and all that. And so now I'll go call them, and we'll run through the medications, and we'll make sure that looks good. We'll take the potassium off because you don't need that anymore.
My next one with the dialysis isn't until Tuesday because it was now they said it's Tuesday, Thursday, and Saturdays.
Right? And you had it yesterday.
Yeah.
Okay. Yeah, and I guess the other question is, do I need to call your nephrologist, your kidney doctor, and see if you should have dialysis between now and Tuesday, if that's okay to go that long?
Yeah, because they told me I had it the first one I had it was on Friday, and that's when, I was supposed to have it on Thursday, but they found that this didn't work.
Yeah.
So they sent me on Thursday to the doctor who did this.
Uh-huh.
So since they sent me on the Thursday, and I didn't do dialysis, they sent me to get this, so they had me do it on Friday and Saturday.
Oh, back to back.
Back to back.
Yeah.
And then they said since Saturday, I did it on Saturday, so I can go on Tuesday,
Tuesday.
Thursday.
Okay.
Saturday.
I mean, and that in and of itself may be a lot of why you've been having these ups and downs the last few days, because it's a lot. It's a big change, it's a big stress to your body to like be going from peritoneal dialysis to
Yeah.
no dialysis for a period of time to having this procedure done to back dialysis. Like there's a lot, and with the medication changes, I think when you get home, when you get out of rehab and you get home and you're on your medications, things will feel a lot better because it'll be back into your normal routine and there won't be so many changes.
They said that I might be able to go back on the peritoneal.
Yeah, that's what your notes say.
Yeah.
That's what they're hoping. They just can't manage that at the rehab center. Which
Which
is
is
good
it's
because
all for me because
then
I,
you can get this catheter
yeah,
out
and
too.
you get this out and I can do it like I've been doing it all this time.
Yeah.
Which they said congratulations because right now I'm the longest under peritoneal and I'm thinking, okay, they just said that away now. Now I'm gonna have to go back to this. Okay. All right.
Okay. So give me a few minutes.
So
I'll
I
go
can
make.
go home
Let me go.
tonight.
Well, let me just go make a couple phone calls. Again, I'm going to call the rehab center. I'm going to call your kidney doctor. And we just want to make sure everything looks right, and then we can let you go home. I think
Okay, go home to there or go home to where?
probably the rehab center. Yeah.
Okay.
And then I'm also.
I'm trying.
I know. And then I'm also going to get it set up so that you can have somebody calls you to get you set up for follow up in the back pain clinic,
Okay.
just so that they don't forget about you.
Yeah. Thank you.
Okay. Very good.
Thank you.
Anything else that I miss?
No.
When she's healthy, she seems like she's a ton of fun, huh?
Yeah, that she
Keeps you guys all on your toes.
that she does. Thank you.
Okay, yeah.
Thank you.